Healthcare in America is at a crossroads. What are Americans looking for in our healthcare system? And what influence does public opinion have on healthcare policy in our country? I'm Rana Kamal. This is Our Issues, Twin Cities. America, the land of the free, a place of opportunity, and a country of more than 28 million uninsured citizens. Emily has been living without health insurance for some months now.
It's been a little bit scary. Luckily, it's affected me much less than I kind of even anticipated it would because of clinics like this.
She's a patient at the neighborhood Healthsource clinic, which has been providing primary health care in the Twin Cities for more than 45 years, for those covered by insurance and those who are not.
We serve about 30% of our patient population is uninsured.
Steve Knutson is the executive director of the community-based clinic, which now has 3 sites around the metro. How do you work with patients who are uninsured?
As an FQHC, we're able to offer our patients who qualify a sliding fee schedule for all of the services that we provide, which means they're faced with only having to pay a percentage of the total costs of their care. And that percentage is always based on a combination of their household size and their income levels. And so, again, you can't walk into most clinics in the Twin Cities or anywhere for that matter and receive care on a sliding fee schedule.
Healthcare cost in Minnesota has skyrocketed in recent years. In 2016, the state's Department of Health reported the rate of Minnesotans without health insurance has reached an all-time low. Today, about 4.3% of Minnesota's population is uninsured.
Minnesotans want to be able to get the care that they need when they need it and not have to worry about the bills right away.
Jim Schowalter is the president of the Minnesota Council of Health Plans, providing health care for more than 4.8 million individuals. Health insurance premiums are very expensive in our state. Why does our medical care cost so much?
There's some things that keep on increasing. You know, it's hard not to read the news any week and see things like prescription drugs looking more expensive. But at the end of the day, it costs so much because we keep on finding new ways of technologies and new things that are exciting. They help us treat things we couldn't dream of treating before, but they also come at a great cost. And we haven't figured out how to tame that cost and how to ultimately share that cost.
As healthcare expenses continue to spike, Minnesotans are spending more on prescription medication and supplies, and less on care provided by physicians and in hospitals, and more on care provided by other health professionals and in outpatient clinics.
A few years ago, a procedure, you go into a hospital and you'd stay a couple nights, now might be an outpatient hospital visit, and you're home yet later that afternoon. About 19% of our medical bills are for hospitals, about 19% are for outpatient care. That's a big change from where it used to be. Doctors still are about 25% roughly of our total medical spending. That's changed over time in percentage, but it's not like there's less money going there. It's just that there's other things that are growing faster, like prescription drugs. Minnesota Care was one of those examples some years ago where Republicans and Democrats worked together to create a structure that endured for many years. Ultimately, healthcare isn't about politics, it's about people and getting the care we need.
The Affordable Care Act, known as Obamacare, is still the law of the land. Passed in 2009 and implemented in 2014, Obamacare expanded insurance coverage but did little to tackle inadequacies that are fundamental in American medical practice. Republicans fell short the first time around to repeal the Affordable Care Act, but pulled their efforts for a second try, this time passing the bill and introducing the American Health Care Act.
This is not just about repealing the Affordable Care Act. This is about global health care reform.
Congressman Jason Lewis has been very local about health care in America. What are you doing to help enact real health care reform, and what would you like to see happen?
If you just repeal the Affordable Health Care Act, which has some many onerous provisions, but you're back to a situation you have in 2008, 2009, that was not tenable either and gave us Obamacare. So we've got to go back to HIPAA, we've got to go back to 1965, the advent of the entitlement state, and get a handle on a healthcare reform that will work over time. So this is beyond repeal, this is reform. And part of the reform is tax equity, so that people buy insurance on their own. They get the same tax treatment as people getting it at work. Part of the reform is making certain people can buy catastrophic insurance that is cheaper for younger, healthy people. No price controls, so prices can drop for younger, healthy people. And of course, getting a handle and limiting the federal taxpayer liability on Medicaid, which is growing, well, it's the fastest entitlement when it comes to growth in Washington right now, 3 times larger than what it was under President Clinton.
Providing health coverage for low-income people, Medicaid accounts for nearly 70 million people in the country. But over the next decade, President Trump plans to slash more than $800 billion from the federal health program, leaving many uncertain with the new reform. The American Health Care Act is projected to raise premiums, increase taxes on the elderly, and 23 million Americans may lose their health insurance.
This current reform adds a little more beef to the high-risk pools in the state. We're going to reinvent those. It also gives states waivers to do experiments in what they want. I hope it brings folks together, but in the final analysis, we've got to get something done in Washington. And that's why I'm there to help lead.
Under the American Health Care Act, Congressman Lewis is hopeful Minnesotans will see premiums drop, especially for younger, healthier people who have been priced out of the health insurance market.
I'm confident people can buy an insurance plan that fits their needs, not one that the government says, this is the plan you have to have, and the only place you can get some assistance is on a government-approved exchange. We want people to go to the health insurance market, the individual market in Minnesota, across state lines preferably, we've already passed that bill out of the House, and buy a plan that fits your needs.
Really, there isn't one answer. It's an exploration of finding ways to make sure more people get coverage, more people have an insurance card and they can get the care they need. And then that really big next step, which is how to make sure that great care doesn't come at a great price as well.
When we return, a local program helping senior immigrants adjust to the U.S. healthcare system. There are 41 million immigrants from every corner of the world that live in America. Many come to live out their dreams, start anew, and create a better life. But coming to America is not as easy as it's made out to be. Life as a whole is vastly different for many. A large majority of immigrants who reside in the United States are at risk for inadequate health care.
In this country, especially for the seniors, we don't get much of sunlight, so we get through those supplements vitamin D.
That prompted Awol and Adullahi Sheikh to teach a 6-week course to help East African seniors in their community learn about the importance of taking care of their health as they age. Was there a demand for such a program in the community?
There is a lot of demand. When we start to accomplish or to offer 6 workshops in 1 year. But in year 2014, 2015, and 2016, 3 last years consecutively, we offered or we accomplished 8 workshops in each year. Each year, we added 2 workshops instead of just 6 workshops, which means there's a lot of demand from the community.
The course taught at the Coyle Center is aimed for seniors in the Cedar-Riverside neighborhood who are over the age of 60. Many of the attendees are Somali and Ethiopian immigrants.
The seniors don't get the cultural connection they used to get back home. So they stay in their homes, watching TVs, probably visiting their neighbors. And in the end, what happens is many of them are isolated, depressed.
In their home countries, seniors were used to walking long distances to buy food. In the Cedar-Riverside community, many live in small apartments where access to food is readily available. The lack of physical activity is causing the recent immigrants to have chronic health issues like diabetes, high blood pressure, and high cholesterol.
In African Arabian country and the US, it's different. The health is different.
Ahmed is an attendee of the course. Sheikh describes him as a success story. He came to America as a refugee with nothing in his pockets. He was homeless for a number of years, but today he says life is better.
I'm very happy to get this course because I learned some things or more things I was not to understand before. Because when you come here, this country has a lot of problem, like stress, like the window, the snows, also
The cold
big
weather,
problem.
yeah.
The weather, because we born in Africa. Africa is hard. The people have more age or people adult. They can walk or they can do it everything. Even their age is 75 and above. But here,
Back home you're talking about.
yeah. But here, when you come here and senior and old person, the people stay at home and they couldn't go more times outside.
Sure.
So their health is very low.
Right, it's
And also medicines. So it's not very nice like before. So that's why we have to get a chorus and Balancon community to management or to help ourselves or our health.
Many seniors who immigrate to the U.S. experience culture shock and stress, which can contribute to health issues. The class aims to help them take on these challenges by working with the healthcare system.
What we are doing is to make them understand that their condition is part of conditions they can control through food, through walking, through better sleep, through exercise, through meditation, through swimming, through cycling, and they also understand what diabetes is. Most people don't understand what diabetes is. They will tell you, I'm going back to Africa and go take camel's milk or camel's meat,
Sure,
and that will solve anything. They don't understand the essentials of diabetes being related to an enzyme or an insulin that is deficient in their bodies.
To help the seniors understand the essentials of healthcare, the course is taught in their native tongue and has embedded Quranic verses explaining the importance of taking care of one's health.
When we give them the health messages, they keep it in the Quran. They say this is a spiritual message. So because they are quotes relevant to both our health and their health in the messages. Talking about what the Prophet said, what Islam says, as far as physical exercise, as far as food is concerned, as far as eating is concerned, as far as sleep is concerned, as far as eating, even sharing food and eating as a family.
How has this program been helpful to your class attendees?
This program, especially the chronic disease self-management program, is very helpful for them because it is just telling them to use their knowledge. There is a general knowledge, public knowledge, community knowledge of health. We are just reminding them, watch everything you do, just use your mind. And instead of just running to the clinic, instead of just going to the emergency, just before as somebody who is a senior, somebody who may have one or more chronic conditions, just use your mind, and also to have their own action plans. Like when I said action plans, we just tell them to have weekly action plans. So in the 6 weeks we stay together and we give them this workshop. They know how to set up the action plan for the rest of the year or for the rest of their life.
We tell them, your health is your responsibility. The medical providers will only support you if you are able to maintain a healthier body through eating, through exercise, through meditation, through walking, through swimming, through preventing falls.
Many of the seniors who fill the seats in the Coyle Center classroom spoke of gratitude for the opportunity to learn about one of life's essentials, health. Awol and Sheikh say they will be offering more courses in the future.
It is very helpful because we are getting a lot of information and knowledge about mostly about our health and also about the way of social life, and also we just come together, we chat, talk about our culture, about our language, about our community. So it is a way of thinking about ourselves. So it is very helpful.
Up next on Our Issues Twin Cities, what Americans are looking for in our healthcare system. In 2010, 48 million Americans were uninsured. Although there was a significant drop last year, 28 million are still living without health care. The neighborhood Healthsource clinic in the Twin Cities opens their doors to those with or without coverage.
What kind of patients typically walk through these doors?
Patients from all walks of life, from all income levels, from all nationalities, a whole variety of different patient populations. About a third of our patients require some type of interpreter or translation because English is not their first language. We certainly serve, after that, it's mainly all primary care oriented care that we provide, either chronic disease management or acute illness and injury prevention, that type of thing.
Emily found out about the clinic through her roommate after having a break in her insurance.
How has your experience been here?
People are really friendly. I know I've been to some places and it's been a little bit more oh yeah, I kind of feel like I'm file number 21498, and here it's definitely more of a personal experience, and doctors are really friendly.
How important are clinics like this that accept patients without insurance?
Oh, so important. There's no way I could afford an ER visit or just a regular doctor's visit even. So it's places here at Central Clinic and Planned Parenthood that have just been life-saving.
Healthcare in the United States has been through a long and bumpy road over the years, creating a dividing line for many across the country.
Why is healthcare so difficult to tackle?
It is really difficult to tackle, and I think it is because it is so personal. Every time I talk about healthcare, I start to think in big policy terms, but at the end of the day, it's about the care that I get or you get or our kids get, and that moves us. And we all want the best that we possibly can get. And it's hard to have that conversation so that we all recognize that we're coming from different places, different experiences, and make it work for everyone, knowing there's going to be trade-offs. Because when it comes to your kids or your parents, trade-offs aren't acceptable. And yet, when we talk as a community, we have to think about how do we make it work for everyone or as many people, because right now it's not working for everyone.
The revised GOP bill of the Affordable Care Act could leave more than 23 million Americans uninsured by 2026. A recent poll found that most Americans, including a majority of Trump supporters, want Obamacare to work.
Do you think that most Minnesotans approve of Obamacare?
I think so, and I think the key element is everyone should have an opportunity to get the care they need. I don't think anybody approves of all the policies or all of the ideas, or even most people even understand them. But at the end of the day, I think everyone wants to get care and believes everyone else should too. I think the part that it left out was how to, and it really never addressed, was how to pay for really expensive care that keeps getting more expensive. That wasn't, the first step was getting everyone coverage. And the challenge and the critique of it is, well, but what if it gets too expensive? How do we address that? And I think that's what we have to work on.
The new Republican health care bill is projected to save $150 billion over the next 10 years. By doing that, the American Health Care Act aims to eliminate tax penalties for those who don't have health insurance and end taxes on certain high-income people, insurers, drug companies, and manufacturers of medical devices to finance the existing health law.
What are the majority of Americans seeking in our healthcare system?
I think the majority of Americans seeking the insurance that best fits their circumstance, that doesn't cost $1,000, $1,500, $2,000 a month for a family of four, and doesn't have copays and deductibles that go up with premiums. In the old days, when insurance markets were working better, if your premium went up, your copay and deductible went down. If your copay and deductible went up, your premium went down. Under the Affordable Care Act, unfortunately, premiums have gone up, and copays and deductibles, and a stricter drug formulary and all the rest. Look, we're at the epicenter of an existential healthcare crisis in Minnesota. Back-to-back premium increases of 55% to 67%, 100,000 people thrown off their plan as these insurance companies leave the exchanges. The state legislature has to pass a $300 million emergency bailout. The status quo is not tenable. We can disagree on how we're going to reform the system, but we've got to reform it.
I do know Minnesotans want to be able to get the care that they need when they need it and not have to worry about the bills right away. When we need help, we need to get it, and having that excellent care available no matter what, whatever your circumstance or what your history is important to every Minnesotan. When my son choked on a hot dog some years ago, our first challenge, our first need was to find somebody to help. And when we did find somebody to help, he fortunately didn't have to go into surgery, and we paid for an extraordinarily expensive popsicle. The bill was like $1,000. I was fortunate enough to have insurance that ultimately paid for it, but at that moment, I didn't care. I needed help. And I think that's what everyone wants.
The future of the American Health Care Act now remains in the hands of the Senate, and although Republicans are one step closer to abolishing Obamacare, the new Health Care Act will likely face major amendments in the Senate. Thank you for joining me this week on Our Issues Twin Cities. I'm Rana Kamal. See you next time.